I'm thinking about what to do next on one of these videos, and medical volunteering hours is what came up next on my list. That is something that's also a huge component of the application. I feel like everything is a huge component of the application, but it's important to be well-rounded, and so you need to cover all of your bases and make sure you have something in each and every category in the CASPA application. So medical volunteering hours, you can get those a couple different ways. Now, what I have done is I was able to go on a medical mission trip. I went to Honduras in January of 2013 with Global Medical Brigades, an organization that has a chapter at Texas A&M. That was expensive, but it was absolutely, completely worth it. I loved it. I loved it so much. What we did was we went and fundraised. We also collected a bunch of medications and just general supplies. We had soaps, shampoos, lotions, toothbrushes, toothpaste, all that kind of stuff. And that's super easy to go and ask your local medical offices and dental offices if they have any that they'd be willing to donate. I also had a lot of luck at local hotels. They were so wonderful, and all of them always had a handful of stuff to give. I was really excited about the entire mission trip, so I did a lot of fundraising and supplies gathering, and I ended up getting over $4,000 worth of supplies myself to bring on that trip. So I was very, very proud of that. It did take a lot of time and effort, but with anything, the more time and effort you put into it, the greater the results, and you get out of it what you put into it, and I definitely put in a lot, and I loved it. So through the medical mission trip, I was able to shadow 2 family practice doctors, a gynecologist, 2 dentists. I actually got to perform parts of some fillings myself, and I helped with extractions. That was actually really cool. That was probably the most hands-on stuff I got because I was, inside the patient's mouth with the filling. That was pretty cool. Then I also, with the gynecologist, I prepared the the pap smear materials and supplies, and made sure everything was sanitary. And with both doctors, I did translating. Spanish is my minor, so I was able to understand a little bit of it. I'm not by any means bilingual, but I'm definitely conversational. So that was really neat to be able to practice my Spanish in a medical setting, because that's something that I would like to do for the rest of my life as well. I think being bilingual is a very important skill, and especially since I want to stay in Texas, and I think that knowing English and Spanish will only help me in my career. And I also really like to travel, and I want to keep on doing that, so Spanish is important. But yeah, so I did all that stuff medically, and everything I did counts as hours. So all of the fundraising that I did, the supplies gathering, the donations, all of that is medical volunteer hours, which is awesome. And then we also did pharmacy. We did a pharmacy at the medical mission trip, and we did a charla, and a charla is like a little chat where we did educational skits and yeah, mainly skits to teach the kids and the parents about, proper hygiene, and just to get everybody excited about taking care of themselves. All of it's really fun. All of it was really, really fun. I think my favorite part was probably being in triage, because you are the first contact with the patient, and they don't care who you are. All they know is that you're there to help them, and it was really powerful to be there and know, this is going to be me one day. This is going to be me in my job. I will be getting paid for this, and it's the first step into, seeing if I really like it. And I absolutely loved it, because you're sitting right there with the patient. And there was a little challenge of the language barrier, but it wasn't that big of a deal, just because I have been taking Spanish since 7th grade, so that has been a number of years now. It'd be 9 years, which is good for sure. So, did that. We were there for 9 days. 5 of them were doing different medical things. So, I think from that trip, I was able to count about 20 hours of patient contact, and then a whole lot more hours of just medical volunteering. Then what I currently do now is I volunteer at a clinic in town. It's called Texas A&M Physicians. I go in once a week for 4 hours, and I do all of patient vitals and their write-up, like their little history. So whenever they walk in, take their blood pressure, their temperature, their height, weight. If it is a female within the age range, I ask them when was the first day of their last period. And we, for little babies, we do head circumference, we do pulse, respiration, and all that's by stethoscope. And they get weighed and their temperature taken a little differently because they are so little. So, and then I do the patient write-up, which is kind of cool because you get to sit there and talk to them about their entire list of medications and their history and if there's anything else going on and why they're there. So you're also their first contact. So it's like really neat. It's really neat for me because like I'm their first impression of the clinic, and so it's important for me to remain professional and also make them feel really comfortable, because you definitely want their first contact with somebody in the clinic to be a comfortable one. The Texas A&M Physicians is a residency clinic, so all the doctors on staff are residents. They also have their overseeing physicians, of course, but they're mainly residents, which is kind of cool because a lot of them are still learning. So I also get to like run in if they're doing any kinds of like small procedures or exams. That's cool. And sometimes if you're in the right place at the right time, somebody will be like, hey, do you want to come see this? And so I've been able to go in for a couple pap smears. One of the doctors allowed me to use a stethoscope to listen to a diastolic heart murmur, which was really cool. She had the stethoscope on their heart, and then I was able to feel their pulse. And so you could listen through the stethoscope and then feel the difference between, I guess, the pulse and the heartbeat. Still working on terminology, but it's pretty cool. I also get to run a lot of the tests, so blood sugar, pregnancy tests, urinary analysis. What else do I get to do? I feel like I get to do a lot. It's a really wonderful opportunity. A lot of your local clinics will have different opportunities like this. Also, hospitals have a lot of different volunteering opportunities as well. A lot of times you have to apply for them, but it's a really simple application process, and they're in dire need of help. So, I haven't really heard of anybody be turned down for volunteering, but you absolutely need medical volunteering hours because you have to know that you enjoy working in a clinical or hospital setting. That is very, very important. If you do not enjoy what you're doing, if you get grossed out easily, or if, I don't know, you'll find out very quickly if it's not going to be the lifestyle or career you want to choose. And I knew as soon as I walked in the doors and off the plane for the medical mission trip that I was exactly where I needed to be. I love it, love it, love it. And I will continue to gather my volunteering hours, especially through the Texas A&M Physicians Clinic, for the duration of school. And I mean, even after I apply in April, I'm going to still be volunteering there just because I really love it. And just in case, I don't get in the first time around, I want to make sure that I have all my hours still accruing. And so it looks like I'm obviously bettering my application for the next time around. So that's what I'm doing for medical volunteering hours. Definitely let me know if you have any questions. But I'm excited some of y'all are watching these. I'm really hoping I can just help one or, even if I help just one person, I'll feel so fulfilled and that all of this is worth it. And so let me know if you have any questions. I hope you're having a wonderful week and that you're not stressing about midterms as much as I am. But I will talk to you guys later. Bye.